Seniors. Stop 6. Common medications. Silently shutting down your liver. You took Humira 1 this week. There's something humbling about watching someone you love grow older. I've seen many of my patients' mothers, veterans, school teachers walk into my office with that quiet strength only age can bring. But sometimes, behind that calm exterior, there's a silent struggle they don't even realize is unfolding. Take your liver, for instance. It doesn't cry out in pain like a bad back or a stiff knee. It doesn't wheeze like the lungs or race like the heart. It just keeps working. Filtering blood, breaking down medications, handling toxins until, one day, it can't. And what's most heartbreaking? Often, the very pills we take to feel better are what slowly harm it. Today, I want to walk you through 6 common medications that could be quietly wearing down your liver. Medications you may have taken this week without a second thought. I'll explain gently, like I would with someone I care about because I do. And by the end, I'll also share 5 simple healing foods that can help your liver recover and thrive again. Let's begin together. Part 1. Ibuprofen, the comfort that comes at a cost. Imagine waking up with stiff joints like so many mornings before. You reach for that familiar bottle Advil, Motrin, perhaps a generic version, and swallow the pill without a second thought. It helps. You can move again, maybe go for a short walk, water the plants, or meet a friend for coffee. That little pill becomes part of your routine. But here's what many people don't realize. Ibuprofen, a non-steroidal anti-inflammatory drug NSAID, is metabolized entirely by your liver. And with each pill, your liver works quietly to break it down, processing it into harmless byproducts your body can eliminate, that is, if everything is working perfectly. As we age, that perfect system starts to slow. Blood doesn't move through the liver quite as briskly. The enzymes that once swept away chemical waste now work more sluggishly. And the byproducts of ibuprofen. They begin to build up like tiny shards, causing micro-damage, a process we call oxidative stress. I remember Mr. Harold, a soft-spoken man in his 70s. He came in with fatigue and slight abdominal bloating, nothing alarming at first glance, but his liver enzymes were elevated, quiet red flags. It turned out he'd been taking ibuprofen daily for his arthritis on an empty stomach. No one had told him it could hurt his liver. Studies in hepatology confirm this risk. Regular NSAID users, especially older adults, have a significantly higher chance of developing early liver damage, even if they feel completely fine. The real danger. It's silent. You don't feel the liver weakening. There's no early pain. Just a creeping inflammation that, over time, can evolve into fatty liver disease, scarring, and eventually cirrhosis. So, if you find yourself reaching for ibuprofen day after day, please pause. Talk to your doctor. There are alternatives gentler on the liver, tailored to your needs. Relief should never come at the cost of the very organ trying to keep you safe. Part 2. Amoxicillin, the infection fighter, that sometimes fights back. Most of us have been there: a nagging sinus infection, a persistent cough, maybe even a dental abscess. Your doctor hands you a prescription for amoxicillin. You trust it, you take it, and you start to feel better. That's what antibiotics are meant to do. After all, target bacteria and help us heal. But here's something that isn't often discussed in the exam room in some people, especially older adults. Antibiotics like amoxicillin can trigger a strange and silent reaction in the liver. I still remember Ellen, a retired librarian in her mid-70s. She'd taken amoxicillin 3 times in 1 year for bronchitis, then for a root canal, then again for a bladder infection. Months later, she came to me complaining of fatigue that wouldn't lift. Her skin was slightly yellowed. Blood tests revealed liver inflammation, yet she didn't drink alcohol, didn't have hepatitis, didn't even feel sick. What she had was something called idiosyncratic drug-induced liver injury. That's a mouthful. I know. But here's the meaning in plain terms. Even if you're taking the right dose of amoxicillin, your liver might decide to treat the drug like a threat. Your immune cells may overreact and cause inflammation inside the liver, sometimes days, even weeks, after the medication is finished. It's unpredictable. You can't know in advance who will react. And when the liver becomes inflamed in this way, symptoms are often delayed. You might feel just a bit tired. You may notice darker urine or a sense of pressure in your upper right abdomen. But in some cases, especially when the reaction is strong, it can lead to a condition called cholestatic hepatitis, where bile flow becomes blocked. The result: toxin buildup, jaundice, and in rare situations, lasting liver damage. A study published in Clinical Gastroenterology and Hepatology found that amoxicillin combined with clavulanic acid brand name Augmentin is one of the top causes of antibiotic-related liver injury in older adults. And still, this combination is prescribed every day, often without a second thought. It doesn't mean you should fear antibiotics. They save lives when used correctly. But it does mean we should respect their power. If you've taken antibiotics multiple times this year, especially ones in the penicillin family, it might be wise to ask your doctor for a liver function test. A simple blood draw ALT, AST. Bilirubin can offer valuable insight. The liver has no voice. It won't scream when it's in trouble. It whispers in shadows. And sometimes, it needs us to ask the questions no one else is asking. Part 3. Statins. When cholesterol control comes at a hidden cost. If you're over 60, chances are your doctor has mentioned statins. Maybe you're taking atorvastatin, simvastatin, or rosuvastatin. Right now, tiny pills with big promises lower your cholesterol, protect your heart, and reduce the risk of heart attacks. And for many people, statins work. They truly do. They've saved lives. But as with all powerful tools, they come with a responsibility to monitor, to understand, and to listen when the body quietly objects. I remember Helen, 68, a retired nurse who'd been on statins for years. She was active, ate well, never smoked. But during a routine checkup, her liver enzymes were elevated. "I feel fine," she said, and she did no pain, no jaundice, no symptoms. Yet the lab results painted a different picture. Here's what was happening inside her: statins lower cholesterol by blocking an enzyme in the liver that's essential for its natural cholesterol production. It's effective, but it also disrupts the liver's rhythm, its balance. Over time, this can cause mild inflammation in some people. In others, especially seniors, it can lead to something called statin-induced hepatotoxicity, a condition where liver cells become irritated, overworked, and begin to deteriorate. What makes this so worrisome is how quiet the damage is. It doesn't shout, there's no dramatic collapse, just small shifts, a bit more fatigue, a bit less appetite, maybe nothing at all, until blood work reveals a problem. And here's where things get more complex. Most seniors are not only taking statins, they're also on blood pressure medication, diabetes pills, or pain relievers. All of these are metabolized by the liver. The combined load can push the liver past its threshold. Research confirms that the risk of liver injury from statins increases with age, especially when taken alongside other medications, yet routine liver monitoring is often overlooked. That's why I encourage my older patients to ask, gently but firmly, should we check my liver enzymes again soon? It's a simple question that could protect one of your most vital, silent organs. Now, does this mean statins are bad? Not at all. But like any medicine, they need to be matched to your body, your lifestyle, your evolving health. And sometimes, just sometimes, a well-planned Mediterranean diet rich in olive oil, greens, and fiber can do just as much good without asking your liver to carry the burden alone. Part 4. Methotrexate, the double-edged sword for inflammation and cancer. There are some medications we approach with reverence because we know they're strong. Methotrexate is one of them. It's used to treat autoimmune diseases like rheumatoid arthritis and psoriasis. It's also part of chemotherapy for certain cancers. And for many of my patients, methotrexate can be the difference between being bedridden and living life again. But here's the quiet truth: while methotrexate brings relief, it also brings risk, particularly to the liver. I once cared for Mr. Alvin, a retired teacher in his early 70s. He had battled severe arthritis for years and finally found relief with low-dose methotrexate. It worked. His joints became less inflamed, his mornings more manageable. But after about a year, his liver numbers began to shift. AST. Those quiet biomarkers we watch closely were rising. Why? Because methotrexate is processed almost entirely by the liver. Every dose leaves a mark. And over time, those marks can accumulate, like etchings on soft stone. The first phase is called fibrosis, when the liver begins to develop scar tissue as a defense against injury. If it continues unchecked, it can evolve into cirrhosis, a condition where the liver becomes so scarred it struggles to do its job filtering toxins, aiding digestion, making vital proteins. In the worst cases, this leads to internal bleeding, liver failure, and loss of life. For seniors, the risk is even greater. As we age, our liver and kidneys naturally slow down. The body doesn't eliminate methotrexate as efficiently, it lingers longer, doing more harm. And here's the part that's easy to miss: the damage often happens silently. Many patients, like Mr. Alvin, feel better from the arthritis, even as their liver begins to suffer. That's why patients on methotrexate should have their liver monitored every 1-2 months, especially in the first year. Sadly, many don't. Either they forget or the system fails to remind them, and some assume that because they're on a low dose, it must be safe. But studies, including those from the American Journal of Medicine, have shown that even low-dose methotrexate can cause liver damage over time, especially if the patient is older, dehydrated, or taking other medications. The good news: there are ways to reduce the risk. One is folic acid supplementation, which can help the liver process methotrexate more safely. Another is open communication, asking your doctor, "How's my liver doing?" may seem simple, but it could be life-saving. We all want relief from pain, but we must never trade today's comfort for tomorrow's crisis, especially when our liver is the one absorbing the price. Part 5. Diclofenac, the potent painkiller. Hiding in plain sight. Diclofenac may not be a household name, but chances are you've seen it, maybe even used it. It hides behind friendly-sounding brands like Voltaren or Cataflam. Sometimes it's a pill, sometimes a gel you rub onto sore knees or a stiff lower back. For many older adults, it feels like a blessing. "Doctor, this cream is the only thing that lets me sleep through the night," one of my patients once told me. And I understood chronic pain is exhausting. But here's what often goes unsaid. Diclofenac is one of the most liver-toxic NSAIDs ever studied. Unlike ibuprofen, which usually causes slow, mild liver strain, Diclofenac has a reputation for something far more dangerous: sudden, severe liver injury. I've seen cases where patients were hospitalized within weeks of starting it. Let me tell you about Clara. 75. She was an active gardener, known in her community for her roses. After a minor injury, her physician prescribed oral diclofenac, and to her, it worked wonders. But within a month, she felt tired. Her skin began to yellow slightly. Lab work showed signs of cholestatic hepatitis, a serious condition where bile, unable to flow properly from the liver, backs up into the bloodstream. Her case wasn't unique. Studies from the British Medical Journal and Drug Safety ranked Diclofenac among the top prescription drugs linked to liver failure requiring hospitalization. The risk worsens when diclofenac is used both orally and topically, as many people do. What they don't realize is that the gel form isn't just surface level. It still enters the bloodstream and adds to the liver's burden. And when your liver is already processing other drugs, statins, blood pressure pills, sleep aids, it can quickly become overwhelmed. What makes diclofenac so deceptively dangerous is its presentation. It looks gentle. It's readily available. It's even in some over-the-counter formulations outside the U.S., but inside your body, especially an aging one, it can become a storm. So what do? We don't panic, but we pay attention. If you're using diclofenac regularly, especially in pill form, have a conversation with your doctor. Ask for liver function tests. Explore safer pain management alternatives like physical therapy, turmeric supplements, or topical magnesium. And if you're using the gel daily, even that deserves monitoring, especially if you're also on other liver metabolized medications, because the liver doesn't protest loudly. It doesn't beg for help. It simply slows, quietly, until one day you realize it can't carry your load anymore. Part 6. Acetaminophen, the gentle pill that isn't always gentle. Of all the medications we've discussed, this one might surprise you the most. Acetaminophen, better known as Tylenol, is everywhere. It's in cold and flu remedies, nighttime sleep aids, arthritis pills. It's the pill we give to children, the one many seniors reach for when ibuprofen is too harsh on the stomach. It feels safe, familiar, even comforting. And that's exactly what makes it so dangerous. Let me tell you about James, a quiet, soft-spoken man in his 70s. He came to me not because he felt ill, but because his daughter insisted something wasn't right. He seemed more tired than usual. He was skipping meals. He had a vague discomfort in his upper abdomen. Nothing dramatic. But blood tests told a different story. His liver was in distress. He'd been taking acetaminophen daily, 2 pills in the morning for his back, another before bed. What he didn't realize was that his cold medicine and sleep aid both contained acetaminophen too. Altogether, he was unknowingly exceeding the maximum recommended dose. You see, when the liver processes acetaminophen, most of it is neutralized safely, but a small fraction becomes a toxic compound called NaPQI. Under normal circumstances, the liver uses a powerful antioxidant called glutathione to detoxify it. But if the liver runs out of glutathione, especially in older adults, where natural levels are lower, that toxin builds up and begins to attack the liver's own cells. And here's the terrifying part: acetaminophen is responsible for nearly 50% of acute liver failure cases in the United States. Not alcohol, not illegal drugs, just Tylenol, and yet, people rarely question it. Doctors recommend it, ads promote it. Labels downplay the risk, especially when you're taking multiple medications that all contain it. For seniors, the margin of safety is much thinner. With age, the liver loses some of its natural defenses. Glutathione levels drop. The detox process slows. Even a dose considered safe on the label can become dangerous over time. Symptoms of early liver damage can be subtle fatigue, mild nausea, or discomfort under the ribs. They're easy to miss. But if caught too late, liver injury can progress quickly to liver failure, hospitalization, or even a transplant. So here's what I tell my patients, and what I now gently tell you. Read the labels of every medication you take, even the over-the-counter ones. Add up the total amount of acetaminophen each day. Keep it under 3,000 milligrams daily, unless directed otherwise by your doctor. And if you take it regularly, even just a few times a week, ask for a liver function test every 6 to 12 months. because that little white pill, taken with the best of intentions, may be demanding more from your liver than it can give, but it doesn't have to end that way. There are safer choices, thoughtful alternatives, and simple ways to protect the liver that's been protecting you all along. Part 7. 5 healing foods that support and regenerate your liver. After all, we've talked about the quiet damage, the hidden risks. It's important to remember this: the liver is a miracle organ. It doesn't just endure, it recovers. If given the right tools, it can regenerate, rebuild, and return to health. And sometimes those tools aren't found in a pharmacy, but on your dinner plate. Let me walk you through 5 natural foods I recommend again and again in my clinic, foods that are gentle, accessible, and surprisingly powerful in helping your liver heal. 1. Beets, nature's liver cleanser. These deep purple roots do more than brighten a salad. Beets contain a compound called betalain, which reduces inflammation and oxidative stress in liver cells. They also help improve blood flow and support detoxification by enhancing bile production. Fresh beet juice, roasted beet slices, or even a warm beet soup a few times a week can make a quiet but real difference. Some studies suggest beetroot extract can improve liver enzyme levels, especially in those with early signs of fatty liver disease. I often tell my patients, think of beets as a soft brush for the liver, sweeping away residue, gently encouraging function. 2. Garlic, the tiny detox powerhouse. This humble bulb contains sulfur compounds that activate liver detox enzymes. It also provides selenium, an antioxidant mineral that protects the liver against damage from toxins, including medication byproducts. 1 or 2 cloves a day raw, crushed, or lightly cooked can go a long way. Garlic doesn't just help your liver, it also supports your immune system, your heart, and your gut health. I had a patient in her late 60s who simply added garlic to her evening soup each night. 6 months later, her ALT and AST levels dropped gently, steadily. Sometimes small steps add up. 3. Leafy greens, the liver's green shield. Spinach, kale, arugula, collard greens. These chlorophyll-rich vegetables help cleanse the blood, bind to heavy metals, and reduce chemical load on the liver. They also provide magnesium and potassium, essential for bile flow and fat breakdown. The goal isn't perfection, it's consistency. A salad a day, a handful of greens in your morning smoothie, stir-fried greens with garlic and olive oil at dinner. I often say leafy greens are like a daily apology to your liver for every pill, every processed snack, every long day it worked without thanks. 4. Turmeric, the golden healer. Turmeric's active compound, curcumin, is a potent anti-inflammatory that's been used for centuries in traditional medicine to treat liver conditions. It helps reduce inflammation, protect against cellular damage, and even stimulate liver cell regeneration. One study published in Liver International found that people taking curcumin supplements showed significantly lower liver enzyme levels. You can enjoy turmeric in warm teas, curries, golden milk, or even as a supplement. Just make sure it's combined with a bit of black pepper. It helps your body absorb the curcumin more effectively. 5. Avocados, the creamy liver booster, rich in monounsaturated fats, fiber, and glutathione-boosting compounds. Avocados are a quiet liver hero. Glutathione, you may remember, is the antioxidant your liver uses to neutralize harmful toxins, especially from medications like acetaminophen. Even half an avocado a day can support detoxification, reduce fat buildup, and improve enzyme levels. And for seniors struggling with appetite or digestion, avocados are easy to eat, nutrient-dense, and satisfyingly creamy. They nourish without overburdening. You've listened to a lot today. You've heard truths that were hard but necessary, and I want to end not with fear, but with hope. Your liver may have taken more than its fair share over the years, but it hasn't given up on you. It's still working day and night to keep you balanced, clean, and alive. Now it's your turn to care for it in return. Check your medications, have a heartfelt conversation with your doctor, and fill your plate with the quiet healers nature has already provided, because it's never too late to give your liver a second chance. If you've stayed with me this far, I want to thank you not just for listening, but for caring. It takes courage to look at the familiar and ask hard questions. The medications we've relied on for years, the ones that helped us move, sleep, or breathe a little easier, they've also carried hidden costs. But this isn't a story of regret. It's a story of awareness, of agency, of renewal. You see, the liver doesn't hold grudges. It doesn't complain. It doesn't keep score. It simply does its job quietly, tirelessly, until the day it can't. But here's the miracle: even after years of stress, inflammation, or damage, the liver still has the extraordinary ability to heal. Bit by bit, day by day. All it asks is that we notice, that we make small changes, that we check the fine print on the bottle. Ask one more question at the pharmacy, or add a splash of beet juice to breakfast. So, if you're feeling overwhelmed, don't be. You don't need to overhaul your whole life. Just begin with one step. Maybe it's switching a pill, adding a salad, or booking a checkup. Your liver has done its best for you. Now, perhaps, it's time to return the favor. From one human being to another, take care of it gently, and it will quietly, faithfully take care of you.